Recent advances in breast cancer treatment are showing promise for those with advanced cancer to live longer, better quality lives. Thanks for joining us for this week's Health News You Can Use. I'm Dan Cohen. This week during Breast Cancer Awareness Month, we're talking about the latest developments in treatment and a unique center tailored for those with advanced breast cancer right here in Kansas City. With me today is Dr. Tim Pluard, Medical Director of St. Luke's Cancer Institute and St. Luke's Coote Center for Advanced Breast Cancer. Thank you for joining us today.
Glad to be here.
This year, the FDA has approved 2 new drugs for certain types of metastatic breast cancer and granted breakthrough therapy designation to 1 additional treatment. Dr. Pluard, can you briefly tell us about these new therapies?
So there are 2 new drugs. One is datopotamab, and the other is Enhertu, which has actually been around for several years now, but has really expanded its utility and its impact on metastatic breast cancer. So these 2 drugs are examples of antibody-drug conjugates, where monoclonal antibodies, which have been around and utilized in therapy for years, attach to a chemotherapy payload. And the antibody delivers the chemotherapy payload directly to the targeted cancer cells and delivers the chemotherapy to those cells while sparing normal cells. So we get greater effectiveness and fewer side effects from these treatments. And so in HER2-positive breast cancer, where Enhertu was originally developed, that's about 15 to 20% of all breast cancers. But we've subsequently found out that there are low levels of HER2 on many more breast cancers. And so Enhertu has shown its effectiveness in now about 75% of all breast cancers. So it has greatly expanded options for patients with metastatic breast cancer.
I was just going to say, this sounds like an incredible positive for patients with advanced breast cancer now.
Yes, because previously we didn't consider them candidates for HER2-targeted therapy. And now they have extremely effective therapy. And we really have not used much traditional chemotherapy in these patients now. So their treatments are much more tolerable.
That's very exciting. How does genomic sequencing play a role in these new treatments?
So the genomic sequencing is critical now because we can identify specific mutations or abnormalities in an individual cancer and target our therapies towards that abnormality. And now we can do this sequentially because we don't have to do biopsies. We can just get blood and identify the tumor DNA in the blood and see how it evolves in response to our treatments so that we can adjust our treatments going forward.
Really appreciate you explaining that. St. Luke's Coote Center for Advanced Breast Cancer has a unique approach to a patient's treatment. Can you tell us about that approach?
Sure. So we started the Coote Center 9 years ago and really focused on 2 primary objectives. One was to improve the outcome for patients with metastatic breast cancer, largely focused on clinical trials and research around novel treatments. But the second aspect of it was, how do we help patients with metastatic breast cancer not only live longer, but live better? And how do we do that by integrating psychosocial support, nutrition, exercise, and physical therapy to really maximize not only the length of life, but the quality of life.
That's great. Finally, what's your message for those with metastatic breast cancer that you want to share?
It's a time to be very hopeful. The science has been incredibly rapidly improving, and we have treatments now that we didn't have 5 years ago. So many of them. And so it's a great time to see these advances.
Dr. Pluard, we appreciate the great work that you're doing and for joining us today. We really appreciate it.
Thank you.
To learn more and schedule a consultation, visit stlukeskc.org/Koontz. That's stlukeskc.org/KOONTZ. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.